Hello.
Hello. I'm gonna wash my hands. Alright, can you state your name and date of birth?
Jacob DePaulo, January 16th, 1991.
Alright, where are you at?
I'm at home
Okay, and do you know why you're here today?
for a physical assessment.
Perfect. So you are alert and oriented times 4, which means person, place, time, and situation. I noticed that your posture was erect, your gait was steady, you were calm in demeanor, and your speech is not slurred. And you're able to answer my questions, so your hearing is appropriate. Are you in any pain today?
No.
Alright, so let's get started. Your vital signs were already obtained. They were within normal limits. We assessed your temperature, your heart rate, your respiratory rate, your blood pressure, and your oxygen saturation. Your skin looks normal in color. I don't notice any edema, cyanosis. It's appropriate color for ethnicity. So we're going to start with your eyes. We're going to pull down your bottom eyelids for me. Your conjunctiva is pink, your sclera is white, and your corneas are clear. I'm going to shine a pin light in your eye to check alright, your reaction. Perfect. I'm going to move this pin light closer. When I say focus, I'm going to have you focus on it, okay? Can you focus on the pin light for me? Perfect. Your pupils are equal, round, and reactive bilaterally and appropriate to accommodation. We're going to check your nose. I'm going to have you take one finger and cover one nostril. Breathe out. Alright, we're going to do the same thing to the other side. Perfect. Your ears are clear. Are your ears in any pain today? Alright, is it okay if I touch them? Alright, I'm looking for any redness or tenderness. Do you feel any tenderness when I touch them?
No.
Alright, and they are not red. And your hearing is still appropriate. Now I'm going to look inside your mouth. Alright. And mouth is moist, your uvula is midline, your dentation is intact. I don't notice any open sores. Perfect. We're going to move down to your neck. I'm going to check your carotid pulses. Alright, they are equal bilaterally and strong, so +3. Excuse me. I'm going to check for any carotid bruits. I'm going to have you take a deep breath in and hold it. Perfect. You can breathe out. We're going to do the same thing for the other side. Perfect. No bruits are noted. I do note that your respiratory effort is normal and quiet. We're going to move down to your chest and we're going to check your heart sounds. Alright, so I'm going to check your aortic, which is your second intercostal space on the right side. Then I'm going to move over to your pulmonic, which is your second intercostal space on the left. Then we move down to the Erb's point, and that's where you're going to hear your S1 and S2. And then I'm going to move down to your tricuspid, which is your fourth intercostal space, sternal border. And then I'm going to move down to your mitral, which is your fifth intercostal space, midclavicular. I'm going to listen to your apical pulse for 1 minute. typical pulse rate is going to be 96. Your S1 and S2 were present and didn't note any murmurs, clicks, or extra beats. And then now we're going to listen to lung sounds. Just gonna have you breathe normally for me. We're gonna listen to your posterior lung sounds. So have you turn around. And just breathe normally. And you can turn around. Your anterior and posterior lung sounds were clear and equal bilaterally. Now we're going to move on to your abdomen. And again, we're going to keep the patient's shirt on to protect the patient's privacy. So I'm now going to listen to your bowel sounds. The abdomen is also not distended and it is symmetrical. Any pain in your abdomen today? Perfect. We're going to listen to the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. We're also going to listen to your vascular sound. Take a deep breath and hold it. Perfect. Your bowel sounds were normoactive and your vascular sound was normal with no bruise present. I'm now going to palpate your abdomen. I'm starting with the right lower quadrant, right upper quadrant, move over to the left upper quadrant, and the left lower quadrant. Any pain on palpation? Perfect. Now I'm going to have you lay back. We're going to check for JVD. And we do notice JVD, so we're going to set you up at a 45-degree angle and reassess. Perfect. JVD is not present. While we have you laying back, we're going to check your range of motion in your hips and your knees. So go ahead and bend your right leg up for me and then bend your leg out. Perfect. You can put it back in place. Go ahead and extend that knee and you can lower it down. We're going to do the same thing on the left side. Perfect. Out and then back and then bring that knee up for me. Good deal. And you can relax it. Have good range of motion. If we were going to assess the femoral artery, we would palpate right here. We're not going to do that on the patient to protect the patient's privacy. We are going to go ahead and assess the dorsalis pedis pulses. They are strong and equal bilaterally, +3. And then we're also going to assess the posterior tibial pulses. They're strong and equal bilaterally. We're going to assess the range of motion in your ankles. So can you rotate your ankles for me? Good range of motion in those ankles. Then I have you push against my hands. We're going to check the strength in those feet. Perfect. And good strength. The skin is good. It doesn't have any bruising, any swelling, any edema. We're going to assess the temperature. Temperature is warm and normal. Alright, we're going to go ahead and have you sit back up. We're going to move up to the upper extremities. We're going to assess the temperature in the upper extremities. It is warm and normal. And we're going to assess your brachial pulses. Brachial pulses are strong and equal bilaterally, +3. We're going to assess your radial pulses. Your radial pulses are strong and equal bilaterally, +3. Temperature is warm and normal. We're going to assess the capillary refills. Capillary refills are less than 3 seconds bilaterally. And now we're going to check the range of motion in your elbows. Can you bend your elbows for me, and can you extend them? Perfect. And we're going to move down to your wrist. Can you rotate your wrist for me? Good. And then I'm going to test your strength in your fingers, and go ahead and squeeze. Yeah, strong strength in your fingers. You can go ahead and relax those down. And then now we're going to assess your popliteal reflexes. I'm going to use my stethoscope. Go ahead and put your feet on the floor. And I'm just going to, perfect. All right. You have good popliteal reflexes. And now we're going to check if we were going to check the clonus reflex, we would move the foot back and forward. And if it stopped moving when we were moving it, when we stopped moving it, if the foot continued to move, then it would be positive, and if it stopped moving, then it would be negative. Now we're going to check sensations. I'm going to have you close your eyes and tell me where I'm touching you.
Left arm, right leg, left leg.
Perfect. Your sensation is intact. We're going to lay you back in the bed. We're going to raise your bedrolls up ×2. And we're going to lower the bed all the way to the floor. We're going to lock it, and we're going to make sure the call light is within reach, and we're going to keep HIPAA maintained.